and they're part of a group called India COVID SOS. One of them is Dr. Sejal Tanna, an infectious disease physician at Northwestern University's Feinberg School of Medicine. Thanks for joining us, Doctor. Also, you have family there right now, don't you?
I do. Both of my parents were born and raised in India, so the vast majority of my family is there in India.
How are they doing, and how has this become such a crisis, a COVID crisis in India in particular?
Yeah, I would say everybody there is terrified. They're too scared to even go get their second vaccine because they don't want to leave the house for fear of being infected. How it got this bad is really a complicated question. I think it was a variety of factors, including these new variants that we're seeing, that India had started to open up. They initially had a very strict lockdown, but it had opened up most recently. And the culture there is very different. Most people live in joint families. It's very hard for a lot of people to work from home. So there's a combination of factors, including religious ceremonies and election rallies, that contributed to this rise.
Times like this, when I know, especially when you're dealing with family members, it probably feels so far away. But tell me how you and other local doctors are helping.
Yeah, so there's a group of physicians in North America called India COVID SOS who have really rallied together to try to figure out how to combine our efforts to be most effective in India. One of the biggest things is philanthropy and trying to donate money to India so that resources like oxygen, PPE, ventilators, even wood for cremation services can be acquired. One of the big things is trying to battle misinformation. India SOS has made an infographic that's been translated into numerous Indian languages to help describe how to treat COVID at home and what medications and therapies are not effective.
Well, I know it must be hard for you, as Ben was saying, you can't get there and you can't be with your family members. Do you think the U.S. is doing enough to get more vaccines there and to get help there?
India is a massive country with over 1 billion people, so I think we've made a good start, but I think they're going to need a lot more help. They're going to need oxygen, they're going to need ventilator, they're going to need trained medical staff and vaccines, of course, but we're not going to be able to vaccinate our way out of the surge.
And what's your sense of where things go in the days and weeks to come in India?
Yeah, just like we saw in the United States, after the positivity rate starts to climb, it takes a couple weeks before we see the hospitalizations and the deaths start to climb as well. We're also very concerned that the numbers that the Indian government are reporting are a vast underreporting of the numbers that we're actually seeing there in India. And so I'm really worried that this is going to devastate India and that we're going to see a lot more deaths, more so than what's being counted officially.
Oh, doctor, do you think that they can catch up? I know, as you said, the U.S., we had some, we went back a little bit, we went forward, we went back a little bit. But do you think that India can catch up and get a hold on this?
I really hope so. I think that this is a whole different ballgame with more contagious variants. They have different vaccines there that haven't held up as well to variants like the mRNA vaccines that we have available here in the United States do. And it's already been unleashed, right? It's going to be hard to catch up, and they're going to need some really effective measures and a lot of global health and money and philanthropy from the rest of the world in order to catch up.
Alrighty, Dr. Sejal Tanna from Northwestern University's Feinberg School of Medicine. We appreciate your time. Thanks for joining us.
Be safe, be well.
Next for us, a big game for the Bulls.